think AI is going to have lots of opportunities to improve how we do research, from all aspects of research to administrative aspects, from submitting an IRB, processing IRBs, writing grant proposals, all the way through actually performing research, searching for new drug targets, identifying new opportunities with the genome. All of this is going to be powered by computation and by artificial intelligence. We are currently facing a crisis with healthcare finance, right? We are all facing very significant fiscal pressures. And we also know as a country, we spend some of the most on healthcare in the world, and don't necessarily have the best outcomes. So I think we are constantly looking for ways to improve the efficiency of care delivery and also improving the quality. I think AI presents an opportunity to help. We may need to invest more in technology and in expertise to use those technologies, but hoping that that will then lead to some savings in other aspects of healthcare. For instance, much of healthcare still involves a lot of manual work. I look at, for instance, on the revenue cycle side and the billing, there are still, tens of thousands of people that are involved in very time-consuming manual tasks for the reimbursement process, for coding the care that's delivered, and then for actually doing reimbursements. I think AI has a really big opportunity to help provide some automation to help make those revenue cycle tasks more efficient. And then I think what the opportunity is, it then frees up some of those people to help with other more essential tasks in healthcare. We are very much still struggling to get enough staff, for instance, to run our laboratories, for medical assistants, for clinicians, for nurses, for doctors. And so if we are able to, creates a huge opportunity to be able to upskill and train our staff on new methods, and perhaps being able to use AI to assist in that process. Yes, I think AI can have a role in helping train physicians, all the way from there are actually a number of interesting startups that are looking at the way we provide education, and can we, for instance, use AI to help develop some of the content that's used to train our clinicians? Can we also do computer adaptive testing and use AI to help us as we're helping understand and assess our clinicians' capabilities, and then target training to where they have the most need? Part of why training is so long is that you need practical experience, and I think that part of being certainly a physician is maybe the most important, and will become increasingly important with technology. Because what's special and what I love about medicine, and why many of us went into medicine, is that you have the ability to connect with people and to truly help people, and a lot of that is the bedside manner, the way we interact. And I think that, at least for now, that is still very much a task that we want done by people. And in fact, we often hear that from our patients with some of these automated solutions that are being tested, is that patients actually don't like to interact with some of these chatbots or other solutions. They much prefer to interact with people. And so I think that there is a way, and this is certainly where we're focused right now, on looking at some of the administrative tasks in medicine. And many of these tasks are the ones that are causing high amounts of burnout in the profession. So things like amount of time spent documenting charts or obtaining prior approvals. These are things that our clinicians sometimes are spending, often referred to as pajama time. They're spending time late at night working on these tasks. And these are things we're seeing a lot of positive potential for AI tools. And so, for instance, we're currently piloting 2 products that do ambient documentation. They essentially securely listen to the conversation with the patient's permission between the patient and the provider. After that recording is done, it gets sent to specialized software that does speech recognition, natural language processing, and then uses large language models to summarize that content into a note. So these tools literally draft the note for the clinician. And what we're finding, we have about 800 of our clinicians using these tools right now across Mass General Brigham. And what we're finding is that some of our clinicians absolutely love their products. They are changing their lives. They are finishing their notes before they leave for the day, so that they are not spending their evenings and weekends doing charts. They're spending that time with their family. And they feel like they have their life back. Some of them have even made pretty bold claims that they were thinking of leaving medicine, and now these tools are really changing that. They're much more enjoying their work. And so that's one example of where we're seeing AI actually impact our clinicians, their clinician experience, and care delivery. Yeah, so I think something else that is maybe evident in the World Medical Innovation Forum, we heard some of the groundbreaking research that our MGB clinicians are doing. Increasingly, each year that we hear about this, there is more and more AI and computational technologies that are involved in supporting that research. And so I think as a CIO and as a leader on our digital team, we are starting to think about what infrastructure do we need to put in place to be able to accelerate and enable researchers across MGB to have those both the data and the computational capabilities to continue to be world leaders in this research. And so we're working very hard to ensure that the clinical data, not only the data from our electronic health record, but also genomics data, imaging data, physiologic monitoring data, is available as part of an enterprise data platform, and that it's available in the cloud so that our researchers soon will be able to take advantage of using these data in their research and also be able to use cloud technologies so that they can have access to the latest compute and as much storage as they need. And so this is the transformation that our digital team is working on to be able to better support the research community at MGB. This is going to take time. We have to figure out how we're going to deliver this and also ensure that we have financial models that enable this for our researchers and for our organization.